I am Dr. Brittany Stam, and I'm an OBGYN, and I'm currently in our Sholo office. So chlamydia and gonorrhea are both infections that you can acquire sexually, and they are infections that both men and women can get. And they're infections that are not just limited to genitalia that we know about, but also throat and oral infections as well too. You're having sex, you're at risk. And so women under the age of 24 tend to come in on an annual basis to get testing. Anyone else, it's something that you can do, when you feel like, hey, I have a new sexual partner, if you're worried about an infection, discharge, something new that you have. Those symptoms may look like just abnormal discharge. You might have a burning sensation when you pee. So those things are something to watch for, but it doesn't mean because you don't have symptoms that you don't have the infection. So you definitely want to come in to get that tested. When you do come in for testing, what does that look like? And generally, this is a test that we can do for gonorrhea and chlamydia by a urine sample. We also can do it with a vaginal swab. This is something that is curable. So that's important to know. We get that question all the time. It is something that's treated with an antibiotic. What's really important, though, is that not just you have to take it, but your partner has to be taking that medication as well. The testing, unfortunately, doesn't stop there. Once you've gotten that done, we do want you back in the office generally about 3 to 4 weeks after being tested and treated so that we can do a test of cure. And then we like to have you back 3 months later. So we really want to make sure this is something that is eradicated from your system because these infections long-term do have some sequelae that can be pretty harmful if you didn't get treated for them. And we're looking at infertility reasons because of those and ectopic pregnancies and also just scarring in tubes to affect fertility in the future. What women need to be aware of to reduce their risk, really the only way is if you were not sexually active. Because it is a sexually transmitted infection. But if you are going to be sexually active, it's important to make sure that you're in a monogamous relationship, that you've had conversation with your partner to make sure that they've been tested, and also just using condoms and making sure that you're using them appropriately. Women that are pregnant also can get these infections, and it is something that is part of standard of care. When we see you at pregnancy, it's something that we're going to test at the first visit for gonorrhea and chlamydia, and we can test it other times, especially third trimester if you're somebody who is at a higher risk, because these are infections that you can transmit to your baby. I am Dr. Brittany Stam. I am here at the Sholo office, and if you ever have the desire to come in to get STD testing, we are happy to help you with that. Even if you do not have an STD, come in and see us anyway. We take care of women for all types of issues. Right? Put it right here, and I'll look at it. Because then you don't have to ask me anything. Okay. I just wrote it, You
just hold it? I'll hold it.
Sure. Okay.
You can't do this.
I won't. Put it there.
Okay.
I'll go higher.
Like right here? So then it looks like...
Okay, good. So